Good morning. Good morning. Welcome to a Tuesday episode edition of Sunday Morning Transplant Coffee Talk. I am your host, Steve Belcher. Thank you for joining us. Today, we have a great show. Even though we normally do our shows on Sunday morning, today we were able to get Rosemary Atanga, who was supposed to be on Sunday this morning. So without further ado, let me bring on Rosemary Atanga from the Atanga Kidney Foundation. What's going on, Rosemary?
Hi, Steve. Good morning.
How's
Finally.
everything?
Good.
Good. Thank you for joining us this morning on our early Tuesday edition of Sunday Morning Transplant Coffee Talk.
Thank you so much for inviting me. I'm so happy to be here.
Yeah. So what's going on with you today?
Well, just trying to cope with the very cold weather, the snow. Of course, I don't like the snow, so, I'm just trying to cope, but everything is fine. At least I'm here to, share my own little word about being an organ donor and, helping out with patients who are suffering from end-stage renal disease.
Wow. So how did your story start with kidney disease?
Well, it started when my husband was diagnosed with kidney failure. That was about 20 years ago, precisely. Yeah, 20 plus years ago. And prior to that, I had no knowledge about kidney disease or anything. And when I came here to the United States and he was diagnosed, I started doing my own research and, learned a whole lot about kidney disease. And by the way, he was a high blood pressure patient. So I guess that's how he got his own kidney failure. And, after learning so much about the options, he was on dialysis for 2 months. And then I decided to donate one of my kidneys to him.
Mm-hmm. Mm-hmm.
Mm-hmm.
So how did your husband find out that he had kidney disease? Was it through diabetes or hypertension
Uh, it
or a regular
was
checkup?
It was through hypertension, and he had been taking high blood pressure medication for a very long time. But I guess again, being in Africa, where you know we don't have all of the technology to accurately diagnose certain diseases, he probably started. He probably had the early stage kidney failure right there, but it wasn't diagnosed until he came here to the United States.
Mm-hmm.
Mm-hmm.
Was it hard for you to donate your organ? Did you have any complications with the process?
No, I didn't have any complication with the process, and I mean, it took place at the University of Maryland Hospital, which I understand is one of the top in the country, and I really wasn't scared, and I didn't look at it like I was doing something to save his life, but much more to save a human being. I was doing it mostly for humanitarian reasons
Mm-hmm.
because I get asked the question all the time. I have women who say, "Oh no, I can't do this for this man because but I could have done it for anybody. I could have done it for my child." The good part of it all is that I was spiritually ready to do it because I prayed about it and I just thought it was the right thing to do. Plus, I also trusted the doctors who had to do a lot of tests, and the results came back positive that I was his perfect match. So I really wasn't scared.
Uh-huh. Uh-huh. Did your husband approach you or you approached him?
I actually made the suggestion. I don't think anyone is bold to ask for someone to donate their organ. So I was the one who actually made the call to the hospital and then told them that I wanted to be his possible match. And I told him.
Mm-hmm. Mm-hmm. So was that process pretty daunting as far as getting going through the testing and everything?
No, it wasn't, simply because we had actually been I had met the doctor who was supposed to harvest my kidney. He had met the doctor who was supposed to do the transplant. So it was it was a very simple process. I asked them all kinds of questions. And I mean, it was a whole lot of questions that I asked them, and I was satisfied. And then I went through the testing process, and I think we had to wait for like 2 weeks to get the accurate results back. And then they scheduled the surgery for September 16th to 1998.
Mm-hmm. Mm-hmm. So, how long did that process take?
Honestly, I don't know because I know I was placed under anesthesia, and you're a nurse, so you know the whole process of anesthesia and all of that. But I think that from what they said, it was like a 4-hour surgery. It was done laparoscopically, so I don't have all those. You can't really tell, even if I show you the various lesions on my body. It was a very flawless process. I just remember that I was taken to a room, put placed under anesthesia, and the next thing is I was back there. So it was done meticulously.
Mm-hmm. Mm-hmm. Looks like you
Hmm.
froze up on the screen. There you go. Well,
Okay.
actually, I was talking about the process from the time that uh, you went testing for your husband until you actually had the surgery.
Hmm. Yeah, like I said, it was a very flawless process. From what I was told, it was about 4 hours. It was done efficiently and
Well, no,
meticulously.
no. I
Oh.
mean, I'm sorry. I mean, from the time that you told them you wanted to donate to the time you actually had the surgery, how many months did it take?
I think, because first of all, I had just given birth to a child, or my son. So my son was born April, May, June. I think I told him around June, July. And then, was it June? No, I told him around July. And then we waited for another 2 months because he was on dialysis for 2 months. So the waiting process took about 2 months.
Mm-hmm.
Yeah.
Mm-hmm. Did
Hmm.
you ever think during that time that the process wasn't going to happen?
No, because the doctors had assured us that everything was going to be fine. I was still and they asked me over and over, is this something you want to do? And I said yes. And the only thing is that, of course, I didn't want to get family involved because, first, I'm an only girl child. I come from Africa where, things like that are not very common. So it was difficult for me to tell any of my family members because I didn't want them to discourage me or to be afraid that something was going to happen to me. So everybody, family members and friends, only knew after the fact.
Mm-hmm. Mm-hmm. Wow. Wow. So how's everything working out now with your husband's kidney?
I mean, he's fine. He has had other. I mean, getting an organ from someone else can be very. I mean, we were a perfect match, and he had the kidney for like 7 years, and then had an infection, which I was told was called what is it again? BK virus. You probably know what that is. I don't know what it is,
I
but he
never
had
heard of
an
that.
infection. Oh, really? Yeah, that's what they said it was. BK virus. So the kidney failed. He went on dialysis again and had another transplant, and he's been doing fine. So he's
Mm-hmm.
a lucky patient. Hmm.
Wow, your screen froze up again. Let me see if I could get it unfrozen for you. There you go. Wait a minute. All right, you got see what's going on with Rosemary Atanga. See, we lost her feed. Um, see if we can get her back. We're doing. Hopefully we can. Let me see. Hold tight, y'all. Hold tight. right, had some issues with my cable. Sorry for leaving. We have her back. Hey, Rosemary, how's it going?
Good, good.
Good. So, as I was asking you about the transplant, your husband is doing pretty well.
Yes, he's doing well, very well.
How about yourself? Do you get testing to see what your blood levels are?
Yeah, I'm pretty healthy, and yeah, I'm pretty healthy, and I think God has been good to me. I don't think He will let me suffer a kidney failure for giving, so I'm pretty healthy. I just did my physical um about a month ago, and everything is good so far.
Uh-huh. So when you first found out about your husband's kidney failure, what went through your mind?
I was sad, but I was sad more for him, you know, because I've never been that sick. So I don't know what goes through anybody's mind who is that sick, but I know he was very devastated, especially since we never intended to stay in this country. And I've always just loved to be in Africa where to me life is much more easier. So it was very sad for him and for myself as well. But
Hmm.
again, we were lucky that we he was diagnosed here with all the technology and everything, because if it was there first, they don't have any transplant option. So that would have been a different story. So I'm just grateful that all of that happened while we were here.
Hmm. Hmm.
Hmm.
Did your husband ever have to start hemodialysis?
Yes, he did it for 2 months prior to the transplant.
Was that hard on him?
I guess,
He he
yeah.
never talked to you about it?
Yeah, I mean, I know he was always tired, which I guess is what happens with people who are on dialysis. He was always tired, and he used to go 3 times every week, and very early in the morning, like 5 o'clock, and always complained of tiredness. And every time he went for a session, he had to come back, rest a little bit before going out again to do something. So I guess it was a very tiring process, which I get from so many other patients who are on dialysis.
Hmm. Hmm. Were you surprised that you were a match, that you found out you was a match for your husband?
I was surprised, but I prayed that I should be a match, because I didn't know who was going to do it. He didn't have any direct siblings here, and then so it was a difficult thing, and I didn't know what was going to happen if we didn't get that option. So it was a very difficult thing, and it worked out, you know.
Hmm. Hmm. So, what has been the biggest challenge in giving your husband this kidney?
I That's a tough question. Challenge in what sense? Like, when you say challenge, what
Well,
challenge?
let me ask you this: Have you had any signs of like depression or any medical setbacks as a result from this transplant?
No, no, not at all. Not at all.
Hmm.
Depression, no. I mean, I have my good days and bad days, just like anybody, and you know, but I mean, those are challenges that we all face just for being alive, and dealing with work, kids, and stuff. So
Hmm.
yeah.
So how did the Tanga Kidney Foundation come about?
Well, it came about because I always visited Cameroon, which I still do every single year, maybe once or twice. And I was curious to learn about kidney, like dialysis centers in Cameroon, kidney disease in general. So I went to the local hospital in my place where I come from, and they had just opened a dialysis center. And I think at that time they had about 25 patients. And what was disturbing is when I walked into the center, I saw teenagers from 17 years old. And I was taken aback because I'd never known that kidney disease affected children. And what was more traumatizing is, the pain that these children were going through. They were so tired. I remember one 17-year-old actually finished doing her dialysis. She was supposed to go back home, and she just slumped in the chair. And I was asking the nurse, who was the attending nurse, what was happening. And he said she was just tired. I mean, I felt so traumatized. And I wanted to know their financial situation, how they were paying for it and things like that. And when I learned that they were paying out of pocket, even though it's a subsidized, it's highly subsidized by the government, it was still very difficult because the per capita income is not like here. People live on $100 a month for a family of three, family of four. It just depends. So to think that a child was going through dialysis and that was the cost per month, it really bothered me. So at that time, what I had on me, I just left it at the center and told the nurse to donate a few sessions to the kids who were there. And I kept following up with the doctor, and I told him that I was going to start something. And we actually had created the foundation probably about 6 years ago, but it didn't take off until 3 years ago when we renamed it the Atanga Kidney Foundation. And it gave me a platform to be able to solicit for funds and help these children, because at the end of the day, I had to, from that one center, I was able to, reach out to other centers in the country. Through the foundation, I was able to, be hooked up with other doctors, who now volunteer for the foundation. I met another wonderful doctor online who is a Cameroonian, Dr. Emmanuel Ngassa, and he linked me with his friends in Germany. So through that connection, I've been doing medical missions. I've been to Cameroon 3 times to provide services for patients with end-stage renal disease, like fistula placement, which they all need, and then education, conferences, So the foundation has done a whole lot, but that is how it came about. Those children actually inspired me to launch the foundation, because I just thought, no, I mean, it's just very sad for a child to be undergoing something that most adults experience, and I just wanted to be able to give them a life.
Mm-hmm. Mm-hmm. Can you talk about some of the cases that you've been faced against with the kids? I know we had talked off camera, and you mentioned that one kid had to travel up to 6 hours to get access surgery and ended
Mm-hmm.
up passing away.
Yeah, I mean, if I start talking about those kids, I get so emotional, because that's just one of them. When 6 hours even is that's even I've had kids who did like 7 hours round, like back and forth twice a week. So you're talking about 14 hours a week just to go get dialysis. And in the case of that kid, she had a crisis in her, at her home. Of course, her mother didn't know what to do, took her to a regular hospital that didn't have any dialysis doctor, or any nephrologists or dialysis technicians, and they couldn't manage her situation. So she ended up passing away, you know. And there are many like that. I had another 14-year-old who was traveling to get fistula, and he died on the way. They are just so numerous. I mean, in the 3 years that I've been working with these children, and I know we've lost, from the ones that I can remember, the hospital sending to me, there are at least 18 of them, who have
Hmm.
died. And
18.
yes, and sadly, and I guess the situation is that we are not even technologically advanced to manage pediatric dialysis. And one of my goal is to be able to, help the different centers learn more about pediatric dialysis through these doctors, through volunteers, so that they can know exactly how to manage pediatric dialysis, because I don't think that is something that anyone expected, that children will be going in and out of centers or being diagnosed daily for kidney failure. And another thing is, I have been very disturbed by the number of kids who get placed on dialysis every day. I don't know whether the results are really, really accurate. I don't know the cause of their kidney failure. And we need to be able to. I started a program to do a little research, but in the particular region that that program was supposed to take off, there's been a little bit of unrest. So that program is suspended until further notice. Meanwhile, I continue to reach out to the different places where we have these kids, and you know, we assist them. And I'm sure you've met one of them online who has access to internet. And thank you also for being such a humanitarian, reaching out
Thank
and
you.
helping. Yeah,
Yeah, Mildred.
yeah, Mildred.
Yeah, I really like Mildred. I've become very fond of Mildred.
Yeah, she's a wonderful soul. Yeah.
Wow. So when you go to Cameroon, what are some of the things that you do when you touch down? How is the week planned for the Atanga Foundation when you arrive?
Well, when we are planning a mission, first of all, we have a whole team. We come with our technician, a nephrologist, a vascular surgeon, and this whole team provides all the services that is needed in any dialysis center, to run any dialysis center. So they are there to assist with troubleshooting. What are the various things that, to look out for if a machine is not working, helping the patients understand their condition and the simple things that they can do when they are facing a crisis and they can't immediately go to the hospital. The last time we actually ran a program on fistula surgery, and the doctor was actually doing like hands-on. And that program too has been suspended because the goal was to, you know, uh, empower these physicians with the same skill set to to do the fistula surgery, so that patients don't have to travel to the same place over and over. If you need a fistula surgery, you don't have to leave your region to another region to get that service. Again, that program has been suspended because we're waiting for calm to be restored, so that the volunteers also can feel safe, because I don't want anybody to go out there and then something happens and I start you know blaming myself for not making a better decision. And round the clock we do campaigns, we go out to churches, we go to various meeting houses and educate people about kidney disease, to do annual checkups, which is not common. And then we do free screening for diabetes, for high blood pressure. And we don't just do it for the fun of it. When we see that your results are not good, we refer you to the hospital, and the hospital knows that you're being referred by we have an agreement with the hospital to provide you preventive care, so that you don't go into any kind of kidney failure. So those are some of the things that we've been doing for the community.
Mm-hmm. Mm-hmm. Can you talk um, about transplant in Cameroon?
Non-existent. It doesn't exist. We are still, dialysis is still, I would say, fairly new. It's probably about 30 plus years old. It started like so many years ago, and the nation is still moving into the transplant phase. And I know that we are working on it, because I also work with the head of the nephrology in Cameroon, and it's something that they are working on right now, but it's still going to be a long process. It's not like in the US where they have cadaver donors, they have living donors. It's going to be strictly a living donor program, because we just don't have the technology yet to get to that point where if something happens, and I don't see many people even opting to be organ donors when they die or when they pass away, because people have to mentally, first of all, understand the whole concept, which is still a myth, you know. People believe that when something happens to them, they should go back to their creator the way they came with their full parts. Nothing should leave their bodies for anything. That is the mindset. So it's going to be a long process. I don't know whether in my lifetime that's going to happen, but the program that they are working on right now, it's a living organ program where family members, or just like I donated to my husband, that will be possible. And still, even with that, it's still a whole lot of it's still going to be a daunting task, because most people don't understand the whole idea of organ sharing. Even when I tell my story, people are looking at me like, what, you gave your organ to someone, and which was the reason why I didn't even want to tell anybody. So it's going to be a
Mm.
long way. Yeah.
Well, I mean, it was to your husband, so wouldn't that be high priority if you matched?
Well, I can't talk for anybody, and I don't know how many people will do that,
Mm-hmm.
but I'm just one of the few
Mm-hmm.
that I know of, that I know about.
Right. So if y'all were living in Cameroon at the time when he got diagnosed, then you wouldn't been able to give him a transplant if you were living there in Cameroon.
Yeah, because we don't have a transplant program.
Wow. Wow. Mm.
Yeah.
So what's the youngest child that you helped on
5 months
dialysis?
old.
How much?
There
How
was
old?
there was a child who was diagnosed with it was acute kidney failure, and we were able to send funds fast enough to get that child out of that state. And he's doing fine. He went back home with his parents, and that was a very, very unique case, because when I saw the picture that was sent to me from the hospital, I was like, oh my God, 5 months old with acute kidney failure. What does he need to do? And I just told the hospital, just go ahead with the treatment. Don't stop, make sure you give him all the best, and I'll look for the funds. And I was able to rally people around the community on Facebook, and we sent the money to the hospital, and he was treated and fully recovered before he went home with his parents or with his mom.
Wow. So is diabetes and hypertension prevalent in Cameroon? Is that the
Very.
leading causes of kidney failure, diabetes
I
and hypertension?
I would think so. I would think so. It must be very prevalent, because even when we're doing those medical missions, we discover that so many people have high blood pressure. Most of them don't know. They have diabetes, they don't know. Even though we're doing it as a one-time test, we do, when their results are too high, depending on what they had eaten or what they had done as routine for that morning, we will tell them to follow up and go for additional checkup, and just make sure that they are not hypertensive or diabetic. But people don't just sit like here and say, oh, this is the end of the year or the beginning of the year, let me go for my annual routine. People don't go for annual routine checkups. So they have different priorities, especially when money is such a big issue. So people go to the hospital when they're sick, or when they really, really discover that something is going wrong and then they cannot function. That is when they go to the hospital. And sometimes, if it's kidney failure, then you're going to the hospital at the end stage, when there is no hope, when you already have like end stage kidney disease, and you have to go on dialysis. So one of the things we promote is prevention. If you know your statistics, you can do something about it.
Mm-hmm. Mm-hmm.
Yeah.
Wow. So can you talk about um, the families? You have mentioned that when the kids get diagnosed with kidney disease, that the family think that
Mm-hmm.
they have been um, under some spell or something like that.
Yeah, Yeah, and that is, traditional beliefs, because the sickness itself is something that affects mostly adults. For some of those kids, their parents think that they have some kind of, like, let me call it the way it's witchcraft. Either some family member has bewitched them, or they themselves have some supernatural powers to be sick like that. So especially for the women, and I'm so passionate about girls on, who suffer from end stage renal disease, because their parents don't see value in them. They look at them like, okay, she has this disease. Nobody will want to marry her. Nobody will, she cannot get pregnant. So they look at all the disadvantages that come with it and just devalue that person to the point where they don't even want to give her a chance to live. So I had to make it a point to reach out to these centers and say, hey, you know what? If any young girl should come here and she's diagnosed of kidney failure, just refer them to the foundation so that we can at least see something. I mean, some still do end up dying, but the question is not for that person to die. The question is whether that person has a chance to live, because knowing that you're sick and that there is hope for you to even live if you have an option, and that option is not given to you, it's a very humiliating thing and very devastating. It's like you die before you actually die. So we give those children a chance. We make them forget about what they are going through, make them understand that, there is still hope. We try to rehabilitate them in different ways, make them do things that they like. Like recently, I've been trying to get money for those kids to do something else so that they can start being business owners, even though it's very small money, but at least they can do something that can help them in the future to pay for their own dialysis, because people help and then they get tired, they give up, and then we start all over. So it's a very tedious process, the process of looking for funds for these kids. So I'm looking for a long-term plan, even as a foundation, where we can have our own projects that can generate income, and then we can use that to be taking care of the kids.
Mm-hmm. Mm-hmm.
Hmm.
Wow. Can you talk about the treatment that a lot of these kids get? Meaning it's only like once or twice a week instead of the normal traditional 3 times a week.
Everybody gets dialysis in Cameroon twice a week, and that is because you know the government subsidizes it, and I guess based on an average patient, the government pays about 24,000 to take care of an average patient. So before, they used to give 3 sessions to kids, 20 and below, as from the initial time that I started visiting the centers. That is what I was told. They were getting 3 sessions, but I guess it became very expensive, especially as the number of patients increased. So they just brought it down to 2 for everybody. And even at that, there are patients who brought their own treatment to once a week, because that is what they can afford.
Mm.
There are many patients who will go to dialysis only once, and then when they have extra money, they do it twice. But at least the government pays for them to do it twice, and then they pay a co-pay of about $10 every time they go. So each patient pays about $20 a week,
Wow.
for dialysis, which is
I'm
their
I,
co-pay.
I'm sure if people here in the United States heard that, they'd be like, "Wait a minute, how come I can't pay that?"
I know, right? That's the reaction that people always, that's the reaction. Like, but that's not a lot of money. But guess what? For someone who doesn't work, for a mother in the village who barely can afford to come up with sometimes $20 a month to be able to pull that every week, it's a problem. They can go
Wow.
to the farm and, grow crops and then harvest and be able to eat, but getting the cash flow, it's a different thing. And not to talk of the fact that this is not a treatment that will go anywhere. It's not going. It's a constant treatment for that patient to stay alive. So it's a very, very challenging process.
Hmm. Did you know
Yeah.
anything about kidney disease before your husband got sick?
No, I mean, I'd heard about it, and I guess I knew someone who was, diagnosed with kidney failure, and no, he didn't have any donor, and he finally left from here, went home, and eventually died. But it didn't sink, especially when something doesn't make sense to you, it doesn't make sense to you. I mean, I never went on to research what kidney disease was until my husband was diagnosed with kidney failure.
Mm-hmm. Mm-hmm. So, do you do any advocacy here in the United States, or
Oh
your
yeah.
main focus is Cameroon?
No, I do advocacy here in the United States. I also do health fairs at my church. I educate people. You know, I remember there was someone else who was on a transplant list and needed money to start saving for her medications, which as you know, are so expensive. And I did a lot of advocacy, forwarding her information so that people could donate and explaining to people what it means for anyone to be going through dialysis and have to wait on a transplant list. So I do a lot of advocacy here, and every time I have the opportunity, I take advantage of it. Like I'm planning a health fair in April, and the goal is to also, bring the community together to continue to, you know, uh, educate them about kidney disease prevention. Because what I see is that the same issue that we suffer back in Africa is prevalent amongst our black folks here. When I drive around, I see more dialysis centers in black areas than white areas. I see more junk restaurants in black areas than white areas. When you drive through a white area, you see like Whole Foods. Once you start getting into the city, there is some fried chicken, all kinds of junk places where people can buy things that are not healthy. So I just feel like, we really have to step up because our people suffer more based on the statistics on National Kidney Foundation website. We have more people of color with kidney failure and less people of color on the organ donation list. So while we are the ones suffering from the kidney failure, we are the ones who are not willing to give, even even after we die. So we have to change our lifestyle, our approach, and just live healthy. We have to start making healthy choices. And that starts with parents making sure that their kids are eating more homemade foods than always rushing to McDonald's to call pizza something. Even if we have to go out and eat, those places can be something that we do occasionally. But I think it has become such a norm that eating junk food is becoming like regular. I mean, it's regular for so many people.
Mm-hmm. What would you say to those people who may say that they can't afford to eat healthy and that they're on a fixed income?
Well, junk food is more expensive as far as I'm concerned. you know, I took my kids yesterday to a doctor's appointment, and I was coming back and I had to stop by at McDonald's because they were hungry and fussing in the car. I spent like $24. With $24, I can cook a homemade meal for 3 days, full
You made
meal.
you spent $24 at McDonald's?
Yes.
Wow.
So, but I could take that money to one of those stores and get some vegetables and carrots and all other stuff, and I will be able to eat for 3 good days. So junk food is not cheap. It's more expensive, you know.
Mm.
And then you're loading your system with so much grease and salt, which we should limit. And so it's a whole lot of process to get us out of that mindset of eating junk food.
Mm-hmm. Mm-hmm. So what are the kids over in Cameroon, what are they being diagnosed with at such a young age? I mean, I know they're being diagnosed with kidney disease, but what is the cause of this? Hello? Hey, Rosemary? All right, I see your screen froze. Let me bring you back. Bring you back up. Hey, you there? All right. The like Rosemary's screen froze. Um, Let me see. Stand by, guys. Um, Bring it back up here. Stand by. Okay, guys, I had to go check my router. Sorry for the disruption. We had some bad weather here in Baltimore, so we have Rosemary back again. So, Rosemary, as you were saying, um, what what does the future hold for Atanga Foundation?
Well, I am looking forward to I am looking forward to initiating a whole lot of programs, and like I said, getting the financing has been the most challenging aspect of us accomplishing a lot of tasks. So I'm looking at actually working with businesses that will be donating money to the foundation every single year, and that way we can actually have other projects to generate income and keep the cash flow going, because even the volunteers that I have working, we I mean, they need a lot of support to go from one place to the other, to do so many things that they do for the foundation. So funding has been a very major problem, and I'm also looking at rebranding. And the whole idea of rebranding is because I mean, the scope of the foundation is not only limited to Cameroon, and it seems like the name itself limits it to a certain region and people don't connect easily. So I'm looking at a rebranding option in the future to get a wider audience and to get more people to know that it's not only a Cameroon thing. Of course, any project that you start, you want to start it in a place where you have an upper hand, a place where you know how things are done. But my goal is to take it to different parts of Africa in the future, take it to different parts of the world in the future. So I'm looking at rebranding the foundation in the nearest future.
Really?
Mm-hmm.
Wow, wow. Um, so, do you have any um, projects coming up soon?
Yes, I have a community health fair coming up on April. I'll give you the exact date, around April 20th. And I'm hoping that people can come out and see what we're doing, see how they can become part of it. And if you want to learn more about the foundation, of course, you can go to www.atangakidneyfoundation.org, to learn about some of our activities. So I have that project coming up, and then I will be traveling to Cameroon for the to take part in the uh,
World
National
Kidney Day?
Yes, the World Kidney Day, which we've done very successfully for 3 years, and this is the fourth. So, and that particular program, taking part in that has been very, very effective, because so many people never even knew about kidney disease in Cameroon until the World Kidney Day in 2000, and I think it was 2016, which was children and kidney disease. I actually organized for kids to go on national television so that the nation can see that it's not only an adult disease, it's affecting children, and people should be more proactive in taking their children for checkups. And that was so successful. It was viewed by over 6 million people. So I continue to do that campaign, and I do it for adults as well as children. I did it this year in Cameroon, and I was there too. So it was also very successful. Over 400 people showed up to get free testing for diabetes, high blood pressure, and other things. So
Mm-hmm.
I'll be going home a month or less than a month from now.
Hey, my partner Tamika Moore, she asked, have you looked into a government grants or foundation grants to help you out?
N- no, in order for me to do that, I need to I mean, I just don't, I haven't figured out how to I need to get a grant writer. My church was going to recommend someone to do it for me. So, and then I also have one other wonderful lady, Stephanie, that I met on Facebook through you, actually, Steve. And she has been impressed with what the foundation is doing and hopes to be part of it. So we continue to look for sources of funding. And unfortunately, most large organizations are more interested in communicable diseases like HIV, which has been so highly funded. There is funding for cancer, a whole lot funding for HIV, funding for malaria, but non-communicable diseases like kidney disease, nobody even bothers. But they are more, they continue to be top, like it's not, kidney disease is number 9 right now, and in Africa the projection is that the the diagnosis is going to have more impact in Africa because the governments are not ready for it. They don't have any resources to take care of it. So I think even foundations like Bill Gates Foundation should start focusing on that, because some of the malaria treatments that are given affects people's kidneys. Because first, there are many people hawking drugs, and people buy things that are not the fake drugs and take them or give them to their children, and then the next thing is those things are supposed to be filtered by the kidneys, but when you're putting, it's like drinking poison over and over and over until it damages your kidneys. So I think there should be some kind of funding for this awareness campaigns to to spread across Africa, across the world, so that those who are funding other things don't end up creating more problems for diseases like kidney disease.
Mm-hmm. Mm-hmm.
Yeah.
I agree, because it's not just hypertension and diabetes and other diseases that can cause kidney disease or kidney failure, but you have medications and
Mm-hmm.
other environmental factors that can uh, play a role as well. So let me ask you, if someone's watching right now and they wanted to
Mm-hmm.
donate to someone, or they're thinking about donating the kidney, what words of encouragement could you leave with them from your experience?
Well, for anyone who is watching and they would like to donate, all I can say is that donating is like giving someone a chance to live. If you donate $10, you're giving someone a chance to live for for a day, which sometimes they don't have. I've had patients actually take themselves off of treatment because they can no longer afford. I went to Cameroon 2 years ago, and someone called me and said, "Hey, we need to go to this family." The guy had already taken himself off of dialysis because he was selling his assets and had like 6 children. It was becoming a burden to his family, and he did not want his children to suffer. So he was selfless enough. I don't even know whether to call that selfless, but I guess. But he was selfless enough to call his family, his children, his wife, and he said, "You know what? This is not a treatment that will go away. If I keep selling things to take care of this, then you guys will never have anything to be able to go through your education. I have achieved what I can achieve. Unfortunately, I never bargained for this. So I don't want this to deplete all our family resources. So let us enjoy this moment and wait until I die." And it was so unfortunate that he died, I think, on the 29th. I was trying to catch up with him, and then the lady who went there to tell them that the lady who runs the foundation is around. When she told me, I said, "Oh my God, this guy just died." I was so heartbroken. I mean, sit and think about it. That you're sick. Dialysis patients in this country live for as long as they can live. because the least, they don't have any problems. If they cannot go to dialysis centers, the government provides transportation to take them there. There are many resources. But out there are just no resources. It's your family and people of goodwill. And we are a registered foundation. We have non-profit status. So when you donate, your donation is tax deductible, which is a good thing for people who want to donate more. But they should see it as giving somebody life, even if it's for a day. There are people who cannot even afford to support themselves for one day. We've had so many people who sit and just wait for death because they cannot afford dialysis. So giving it is like giving someone a chance to live, and there is no greater gift. When I started doing this, it really, really brought me to the real essence of humanity. Things that I used to worry about, I used to care about, I don't care about anymore. I don't care whether I wear a dress for $2 or $10 because I always think about it like, wow, you know, the dress that I'm wearing that I might not wear tomorrow can give somebody life for a month, for a year. So I have actually downsized my spending habits so that I can help when I don't have the funding. So I hope people who are watching, who get to watch it later, can actually think about being part of this and not look at it like, well, it's not in my community. We do a lot too in the US.
Mm-hmm. Wow.
I was recently actually at the University of Maryland on invitation by the students, medical students, and pharmaceutical students. They had some event, their annual Give Life program. I can't remember what it was, but I went there to talk about being an organ donor, and they had so many questions. Even though they were medical students, they had more questions for me than I would have imagined. And I was so impressed that at the end of the day, it brought reality to them because they probably think that an organ donor is some supernatural human being, but it's just regular people like you and me, you know?
Mm-hmm.
Yeah.
Absolutely. And hopefully it'll bring more awareness as medical students and they can see the challenges uh, that kidney warriors go through in this process.
Yeah.
So, well, we're definitely down at the end of our time. So, we would like to thank you, Rosemary Atanga and the Atanga Foundation, for coming on our show and explaining how this is done in Cameroon, as well as sharing your transplant donor story with your husband. Yes, definitely appreciate it.
Thank you so much, Steve. And thank you for what you do. I know we have plans to do a whole lot of work, and I am prayerfully waiting for the situation in Cameroon to continue to get better so that hopefully you one day be a witness. You can go there and see that you have more work, you know.
Mhm.
we live
Absolutely,
we, we live in a
absolutely,
global space, and it doesn't matter. We have to start seeing the world for what it is. We're all related one way or the other. It doesn't matter whether you're doing something in Africa, you're doing it here in Japan, China. Saving humanity is something that we should all do with pleasure, with pride, and with honor. Every life matters.
absolutely. I agree 100%. Great. So, well, thank you for coming on, and we encourage you to watch our show tonight, Smashing Kidney Disease. We're going to have on Gary Burley, ex NFL great. He played with the Cleveland Browns for 10 years. So we're going to have him, and then Sorrel, Sisters Against Kidney Disease, which is from 9 to 9:30 with host Sorrel. We'll have on Ebony G, who's a dialysis wellness coach. So uh, if you're not at work, please join us then.
Thank you, Steve.
Yeah,
Bye. And I
yeah.
want to thank everyone who has supported the foundation on Facebook. Oh my God. Facebook last year alone, we raised over $6,000 through birthdays and so many other, just people following me up on Facebook, like following my posts and donating for a patient. And I hope this year people can also donate their birthdays and every other different. I mean, they can do their own fundraiser for the foundation. So Facebook is a very wonderful resource. This year I started a fundraiser the other day. I've already raised $390. So, you know.
Wow.
Yeah.
Absolutely. Okay, then. Well, we look forward to having you back on in the future to see, what you had done when you make your trip, and we look forward to hearing back from you.
Thank you so much, Steve. Have a wonderful day.
You too, Rosemary. Thanks for coming on.
All right. Bye
All
bye.
right. Bye bye. Yeah, guys, tune in tonight as we talk with ex NFL player, great Gary Burley. He's going to be here to share his kidney disease journey. Until then, we'll see you tonight. Thanks for joining us. Have a great day.